Awesome. So uh, thank you for joining us today. This is our lunch and learn. So we do these from time to time. And just Dr. Marable, I would like to introduce him. And Dr. Jeffrey Marable is the Chief Clinical Officer at Primary One Health and the Women's Health Family Services Director at Columbus Public Health. He's an obstetrician and gynecologist with over 25 years of experience, and he's an adjunct professor in OBGYN at Ohio State and a clinical instructor at OU's Heritage College of Osteopathic Medicine. Dr. Marable also serves on the board for the Ohio Better Birth Outcomes and was recently appointed to serve on the mayor, on the mayor's strategic planning committee to reduce racial disparities and infant mortality. He's also an all-around awesome person. I really enjoy knowing him and working with him. I am on the board of Primary One Health, and that's how we know each other. And so I'm just so grateful that you're here with us today. And thank you from all of us. So I'll just launch into the first question. One of the number one things that we were asked as part of the survey by people about the COVID-19 vaccine was, what are the side effects that people can expect to have, and are they very serious side effects?
Well, right before I answer that question, Sam, I first of all want to thank you for inviting me. I am so thrilled to be invited and to be part of your luncheon. I certainly hope this afternoon is one not only educational, I hope it to be educational and interactive. And thank you for that wonderful introduction as well. That was very kind of you.
Absolutely.
So let me go ahead and address the first question with respect to what are the side effects and can they be serious? The most common side effects that we know that's associated with the COVID-19 vaccine is pain at the injection site. So a lot of patients will complain of some soreness or some achiness around where they receive the injection. That's very common. Chills and fever also are common symptoms that are associated with the virus, and extreme fatigue. Extreme fatigue also has been associated. Now, these symptoms are short-lived. So usually within a couple of days, maybe 2-3 days at most, these symptoms should dissipate. Now, there are some symptoms that are more troublesome that you should bring to your provider, or you should have addressed immediately if they should occur. And the symptom that is most severe would be something like an anaphylactic type of reaction. So if you start to develop difficulty breathing, if you start to develop shortness of breath, if you feel like your tongue is starting to become swollen, those are symptoms that are much more serious and they need medical attention immediately.
I know a lot of people have heard about these sort of short-term effects and how long they last, but I think the other question that a lot of people had was, what about the long-term effects? Since this is a brand new vaccine and they haven't had it out very long, how can they know anything about the long-term effects? And if they don't know about the long-term effects, should that stop somebody from being vaccinated?
That's a great question. The truth of the matter is, we don't know if there's going to be any long-term effects. I mean, the vaccine has only been out for a year, and if you count those in the clinical trial, it's been about 12 months or so since the vaccine has been used. But in terms of being used with respect to the general population, that's only been the case over the past 4 months, around November up until now. So we're not quite sure if there's going to be any long-term effects. Based on the information that we currently have, there does not appear to be any long-term effects. So based on that information, it should not stop one from receiving the vaccine. From those folks who went through the clinical trial and who have been followed, like I said, for about a year, other than the short-term impact and reactions that I've just explained, there doesn't appear to be any other sort of symptoms that patients are developing that are worrisome or that we need to be concerned about. So for right now, the short answer to your question is, Time will tell. We're still waiting for more data to come in, but as it stands right now, we do not think, and we haven't seen any sort of long-term impact or effects that we need to be concerned about.
Thank you. I think the other big question we've heard is if you're pregnant or if you're a woman who is considering having children, should you be concerned about getting the vaccine?
Well, first and foremost, I would advise that you talk to your OBGYN. You want to have that conversation with him or her. And I say that because, number one, they know your history, right? They know your background. So they certainly can help you. They can certainly walk you through that conversation with respect to whether or not you are an appropriate candidate. But assuming that you are an appropriate candidate, it comes down to risk benefit. What are the risks accepting the vaccine if you are pregnant versus not accepting the vaccine when you are pregnant? There's a couple of things that we know. We know that women who have accepted the vaccine up to this point have not shown to have any adverse reaction with respect to the pregnancy, with respect to delivering early, with respect to delivering a child with any sort of birth defects, and with respect to having a preterm birth or preterm labor. So we know that to be the case with those women who have received pregnant women who have received the vaccine up to this point. You may be aware that Pfizer BioNTech announced last week that they are going to begin clinical trials on pregnant women 18 years and older between the gestational age of 24 and 34 weeks. They'll be given the vaccine. So we'll have a lot more data within the next few months with respect to the impact of the vaccine and pregnancy. But again, the limited information that we have right now seems to suggest that the vaccine is very safe or just as safe as it is to the general public. Now let's compare that to if you do not get the vaccine when you're pregnant. Well, you run the risk of developing COVID. And obviously what we do know with pregnant women who do develop COVID, they seem to develop more severe cases, more severe symptoms of the disease. So we know that women who've been pregnant and develop COVID, now they do have an increased chance of delivering early. There is an increased incidence of preterm labor in those patients. So that's something that you want to take into account. And again, just the severity of the symptoms and side effects that are associated with the vaccine seems to be more pronounced in pregnant women. So those are the two issues I think you need to have when discussing with your OBGYN whether or not you should accept the vaccine.
That's really helpful. Thank you. So those are the big three. I'd love to open it up now to see if anybody on our team's got questions.
I have a question. I'm wondering if someone has had COVID, should they get the vaccine? And what about people who have not had COVID? Should they get an antibody test to see if they have the antibodies? And if they do have the antibodies, then to me, it would seem that they would not need the vaccine.
Okay, so a couple of things. Let me answer the first part of your question. Your question was whether or not someone should receive the COVID vaccine. Is that correct?
If they've already had it.
If they already had it, yes. So, yes, so the answer is an absolute yes. They absolutely should still receive the vaccine. And for a couple of reasons. Number one, if they've had COVID, we don't know how long the antibodies will last after being exposed. So we think that in all probability is probably anywhere from 3 to 6 months. But if you're beyond that 6-month period after having COVID, then you can be susceptible to developing COVID again. So the recommendation right now from the CDC and from the Ohio Department of Health, and the Ohio Department of Health obviously is supporting the CDC recommendation, is yes, you should still receive the vaccine despite having COVID in the past. The answer, the second part of your question is whether or not you should, is it worthwhile having antibody studies done to determine if you do have antibodies, and then if it comes back showing that you do, then is it worth getting the vaccine? Again, based off of what I just said just a couple of moments ago, you absolutely should certainly consider getting the vaccine for a couple of reasons. Number one, most of the commercial antibodies that are out and that are being sold commercially, they will let you know when you're purchasing or when you're having these antibodies done. Some of these antibodies will give you some false positives. So in other words, the corona antibodies are not necessarily specific, depending on the type of antibodies that you have done. For novel COVID-19. There can be overlap with other coronaviruses. So are you testing positive for a corona antibody that's not specific for novel COVID-19? That's number one. And then number two, again, even if you are determined to have antibodies at that moment on that day, we don't know how long those antibodies are going to last for. So unless you're going to continuously every few months be tested for antibodies, which is, by the way, is not recommended. That's not the standard of care. Unless you're going to undergo antibody testing on a regular scheduling basis. Again, if you've been exposed, if you have antibodies, the recommendation is that you should still receive the vaccine. Now, we do recommend, if you know when you were exposed and how long ago it's been, that you wait for 6 months before receiving the vaccine. So there is a wait time from the time that you've been infected to the time that we recommend that you receive the vaccine.
So I guess to piggyback off of that, if you get the vaccine, how long is that going to last to prevent COVID?
Okay, well, I would like to say forever, but that's probably not the case. The truth of the matter is we don't know. We think that it may be a situation where you're going to have to, on a yearly basis, get the vaccine, similar to influenza, similar to the flu. And just like the flu and just like other viruses, there may be different strains of COVID-19 where they may need to tweak the vaccine. I mean, we're starting to see that now with some of the variants, so that the vaccine may need to be tweaked, which means that you're going to have to get the vaccine that will account for those variations, for those variants. So right now, we don't know. Again, based on the information that we have, we think that the vaccine is at least good for 6 months, but time will tell. And as we go through this year, and again, as we track those individuals who've had the vaccine about 12 months ago, we'll know whether or not they're still protected against COVID, or whether or not, the vaccine has run its course and they're going to need, a booster.
Yes, I have a question. The studies that I've been seeing in the African American community, we have been hesitant to do the vaccination. What would you tell us as African Americans to encourage us to feel a little more comfortable with taking this vaccination?
Yeah, again, great question. And historically, I don't blame you. I mean, there's very good reason, there's evidence to show why there would be reluctance, there would be hesitancy, there would be skepticism in whether or not this vaccine is safe. But I can tell you this much: out of all the information that I've read, that I've seen, that's been presented, this vaccine not only is effective, but it's extremely safe. First and foremost, I've taken a vaccine, so I felt comfortable, and I feel comfortable enough knowing that this is a vaccine that's not going to be harmful to me. And again, the risk benefits, which I always want to, come back to, what are the risks of being exposed, particularly if you have underlying chronic medical conditions that may make you more susceptible. What are the risks of accepting the vaccine versus the risk of getting COVID? The other thing that I've also mentioned is it's going to take trust. We're going to have to build up trust through a lot of different platforms to reinforce that this vaccine is not one that's going to be experimented with certain ethnic groups. And I think if we get the messaging out there via social media, via leaders from your organization, and in addition to via folks like myself and others who have received the vaccine and who can tell you firsthand what they've experienced from anywhere from the type of side effects that they experience and whether or not they've gotten sick from it and whether or not, that if they would recommend it to others. I think until we have that type of positive reinforcement over and over again, so we can start to build trust, particularly communities that are vulnerable and communities of color and communities where, healthcare has not always been deemed as a priority, then, we're going to have the skepticism. And again, rightly so. It's up to us to change that perception. And we can start doing so by having these type of conversations and having others to voice their opinion as to the safetiness and the efficacy of the vaccine, in particular with African Americans.
That's a great question. Thanks. I heard you say that you were, in your research, you saw that it wasn't just one ethnic group that was in the clinical trial. So why was that important to you?
Yeah, and thank you, Sam, and your point is well taken. So during the clinical trials, it was extremely important that there was a wide range of different ethnicities that were included during the study. So you had Caucasians, you had Hispanic, you had African American, you had Native American, you had folks who from the Hawaiian Pacific that participated in the study so that we could get a fair example a representation of how this vaccine impacted different ethnic groups. And so let me just explain that a little bit further, because I think this is important. Because, a lot of people have asked the question, well, did they take shortcuts in developing this vaccine? It didn't take a lot of time from when the vaccine was announced and then when it was approved. So again, is it really safe? Again, let me be one of the first ones to tell you, if you haven't heard, this vaccine is extremely safe based on what we know right now. Now, again, if something were to happen a year from now that we don't know at the moment, then certainly that can change the equation. But there were no shortcuts in developing the vaccine, none at all. It went through all three phases, phase 1, 2, and 3. And phase 1 and 2, which was combined, it was combined for a good reason. The reason why it was combined, because once it was found out that this viral disease, this virus that was attacking and killing folks in an unbelievable fashion, and with a huge volume of folks dying and dying relatively quickly, once it was found out that this was a coronavirus, that was half the battle, because coronavirus is not new. Remember, coronavirus has been out for decades. Some of the common cold is due to the coronavirus. So once they knew it was a coronavirus, they didn't have to wait anymore to see if there could be a vaccine to combat coronavirus. They knew that they could develop a vaccine. What they needed to do at that point was to go through the phase 3 trials. That is to give it to individuals of different ethnicities and to see, one, whether or not only did the vaccine work, but how effective it was in terms of working, and what were the side effects, and were those side effects so detrimental and so severe that it wouldn't be practical to continue with the vaccine. In phase 3, there was no shortcuts. It took the same amount of time for the vaccine to go through phase 3 as any other vaccine. It's just that for them to get through phase 3, they were able to, once identifying that it was coronavirus, be able to combine phase 1 and 2.
So what you're saying, that this vaccine went through the same test that any vaccine would have?
Absolutely, the same test. And remember, this vaccine is different from a lot of other vaccines because we had practically every known scientist around the world working on this vaccine simultaneously. This was unprecedented. So you had great minds working all at the same time for one common cause, and that was to come up with the vaccine to protect an individual from COVID-19. So when you have that concerted effort, when you have all the resources being put into coming up with the vaccine, great things will happen. And, this was one of them. And I cannot tell you how grateful I am to the scientific community and all that worked so hard and diligently to come up with this vaccine. So yes, it is something that I think we all can rest assured that it is safe and it certainly is effective.
And right now they're saying that if you get vaccinated, it's not, you could still spread it. You may still be able to carry it and spread it. Do you think that at some point they'll just be able to figure out that that isn't true? In other words, will there be a point where you're vaccinated and can't spread it?
Okay, so yeah, so that will be probably not the case and less likely. And I say the reason why I say that, because we know there are other viruses where we have vaccines that are out that are effective, but you still have the ability to pass it along. So if your body is introduced to the virus or the antigen, it may prevent you from getting sick. Or if you are sick, you'll get sick with a much milder case of that particular virus. But you still have the ability by coughing, sneezing, talking, singing, yelling, however it may be transmitted, in this case through respiratory droplets, you still have the ability to pass that antigen, to pass that virus that you've been exposed to and transmit it to someone else. So remember, the vaccine is, certainly it protects you, but it leaves those individuals who have not had the vaccine susceptible, even from a person who's received the vaccine, from passing it on to them if they've been exposed.
Do you have a best guess at when the vaccine will be available for kids, like based on age?
And that's a great question. Right now, we don't know. There aren't any studies yet. We anticipate later on, probably in the summer or early fall, that there will be some clinical trials in relation to children. Right now, the clinical trial now is about to take place with pregnant women. Then we think after that, we'll start to also perform clinical trials on children and teenagers younger than 18, but that has yet to be determined or announced. One of the reasons why there isn't that sense of urgency with children, because all the evidence points, or at least seems to suggest, that children do not transmit the vaccine as effective as older teenagers and adults. Not that they can't, and not that they can't get sick from it, and not that they can't get severely sick or even pass away, but the percentages of that happening is extremely small, and so therefore the priority with respect to studies right now are given to those groups that are at higher risk. And in addition to, you have to remember, clinical trials on children is always kind of tricky. There's a lot of factors that come into play that you have to account for. You have to be real careful. You have to walk a fine line before you begin those trials. But right now, because it seems like children are not affected to the same degree, or is not as impactful as it is with the older population, those studies haven't started yet, but we do anticipate later on this year they will.
I'm curious, you said that in the future we may need boosters to get this annually, kind of like the flu shots. Do you think this coronavirus is going to stick around for a long time, kind of like the flu has, or do you think it will fade out?
No, unfortunately, I think it's here. It's here to stay. Like I said, it's a coronavirus. So just like other coronavirus that's been around for decades and even longer than that, we can't we haven't eradicated it. And part of the reason for that is because of the variants, because of the mutations that viruses are known to undergo. I know there's a lot of talk about, the variants that are out from, the variants that now exist. The two that I think that are most mentioned are the ones from South Africa and Great Britain, because viruses will undergo mutations in order for it to survive. And that's how viruses survive. It changes its morphology. It changes its shape. We're going to have to continuously tweak the vaccine to accommodate for those changes. And we do that all the time. We do it with the flu. That's why the flu is here to stay, because we get different strains of the flu. It's still the flu, but because it looks a little different this time around, then we have to accommodate accommodate for that when the vaccine is developed for that particular year. So no, I do think that it's going to be with us. But here's the kicker, though: it's not going to have the same impact as it has over the past year if enough of us are vaccinated. All right, that's the key. Enough of us need to be vaccinated from the virus so that if we're protected, remember, if we're exposed to it, we're not going to get sick, or it's going to be in a very mild form, but we still have that ability to pass it along. And that's what we need to cut off. We need to break that cycle, because these viruses are very fragile. We know how to stop it. You have to break the cycle. You have to prevent it from passing from one person to the next. And you do that by getting vaccinated. So no, I think it is with us for a long period of time, but we can live with it. We can keep it under control.
So to piggyback off of that, then, since you think it's going to be around for a while, does this mean wearing masks for a long time and being still partially locked down for the world is going to hang around too?
No, I don't. No, I don't. And all the evidence seems to show, and all the experts are saying that I've read and that I've seen on television that, later on this, and the president supports this as well, President Biden supports this as well, that later on this year and in the fall, and hopefully by the end of the year, we'll be pretty much back to normal. But this is what it's going to, in terms of our socialization, the way it was pre-COVID. But here's the kicker. This is what it's going to take. It's going to take about 75% or 80% of us having been vaccinated, what they call herd immunity. Once we achieve that, then we can back off, relax some of those, some of those restrictions that we have in place. But I will say this, though. It's always a good idea, particularly if you have a respiratory illness. And I think now, because we've gone through this would be in the back in a lot of people's mind. If you have a respiratory illness, even a cold, it probably is a good idea to wear a mask for that given period of time when you're not feeling well. It just makes sense. It makes sense to wash your hands constantly. Make sure your hands are clean, which can be obviously a source for a lot of germs and bacteria to accumulate. That just makes good sense. And the social distancing, obviously the further away you are from someone who's affected, the less likely for you to be exposed. But we won't have to wear a mask all the time. We won't have to be so limited in terms of being able to go out, to a restaurant, to go to a sporting event, be concerned about going to the grocery store. We won't be living under that umbrella once we achieve herd immunity. So from that standpoint, we will be back to normal, if you will, quote unquote. But I think this will leave a lasting impression with respect to what our behaviors are when we know we're not feeling well, or when we know someone may not be feeling well, how we react or respond to.
So in reference to you saying that you think it's going to be around for a while, in relation to the flu has like what they call a season. Do you think, it may be a little too early to determine, but do you think the coronavirus will have a season, or do you think it could be all year round?
I think the coronavirus is going to be like any other coronavirus, where there's a higher impact depending on the season. So just in general, most viruses, especially those of respiratory in nature, are more impactful or more contagious during the fall and winter months. Why? Because that's when a lot of folks are now gathering indoors. Folks are closer to each other. Remember, viruses, spread by droplets and by close proximity. These viruses can't travel very far. So when you're outdoors, when there's a lot more space, even if someone happens to be sick, it's less likely for that virus to be able to latch on to someone else and cause them to become ill. So I think that the same rationale can be used for COVID-19. During the summer months, you'll see a drop. The spring and summer months, you'll see a drop in cases because more folks are now spending more time outdoors. But once that temperature drops and it starts to get colder and we gather indoors and we have more of these type of indoor events and activities, then you're more likely to see the number increase. So I do think, yes, to a certain extent, it will be seasonal because it's a coronavirus, and I think it's going to act like your typical virus.
So I heard on the news this morning they made very light mention of a possible nasal spray being available for the COVID vaccine instead of a shot. Do you know anything about that and how close that is to being available?
That's interesting because I have not heard of that yet. I mean, I know that within the next. That's interesting because I have not heard of that yet. I mean, I know that within the next couple of weeks, certainly the beginning part of March, that Johnson & Johnson is expected to get approval for emergency use authorization with their one-shot vaccine. And by the way, that's going to be a game changer. That's going to be a game changer because now we can inoculate, we can vaccinate folks, and they just have to come back one time and they're done. Not only that, the Johnson & Johnson vaccine will not require special storage, ultra cold refrigeration, temperatures that are, minus 17, 20 degrees in order for it to still be effective. These vaccines from Johnson & Johnson can be stored in regular refrigeration, and some can be stored even at room temperature. That is a game changer. I mean, just from a distribution standpoint, it's going to be much easier for us to be able to reach folks without having to worry about the vaccine spoiling, if you will. So no, I haven't heard about the nasal administration, although I wouldn't be surprised if eventually something like that will happen, just like other vaccines that we're able to implement intranasally. But I know the Johnson & Johnson is on the verge of getting approval for EUA, and that's going to be a major, major accomplishment.
Well, and I will say, as I also have been vaccinated, the shot did not hurt at all. In case people are really afraid of shots, I know a lot of people are, and I've talked to a lot of people who said the same thing.
Yeah, and I think it's important, for all to keep in mind, again, and even though, there may be a possibility you may experience one of those side effects that I talked about, maybe even all of them, it's short-lived. It's short-lived. So, you may be down and out for a couple of days, but then you recover and you feel normal. But not only now do you feel normal, you can have a peace of mind now that knowing that, after you get your second series, of course, that you are going to be 94 or 95% protected against COVID-19. And after the year that we've had, I don't want to, sound, be a downer, but, unfortunately, yesterday we surpassed the 500,000 deaths in the United States, by far more than any other country. But we're more than double than the next country, which is Brazil. Deaths in this country due to this virus. Whatever discomfort or side effects that you may have over those couple of days, again, the benefit of receiving the vaccine, in my opinion, far outweighs the risk.
Dr. Marable, anything that we didn't ask you that you think is important to know?
Yeah, one of the things I will say for those who've been vaccinated, so the CDC came out with new guidelines about a week or two ago. So if you've been vaccinated and you've received both shots, not just one, but the second one as well, if 2 weeks have passed since you received your second one, and then you come into contact with someone who has COVID, you are not required to quarantine anymore. So that's different, right? You've been exposed to someone prior to receiving the vaccine, immediately you underwent quarantine, right? So 7 to 10 days. But now with the new guidelines, you don't have to quarantine. Now, the caveat to it is that, and you're not symptomatic, right? So if you had the vaccine, you've been exposed, and you're not feeling well, no, you need a quarantine. Or if it's been 3 months or less from the time that you've had COVID, and now you are exposed to someone who has COVID, again, the assumption is that you do have antibodies at 3 months still on board so that you're protected from getting COVID again. But again, the longer you're removed from that, from that period of time, let's say it's been 9 months, there's no guarantee you still have antibodies. And so that's why it's important for you to get the vaccine, even if you had COVID, so that you can be protected with antibodies for a longer period of time.
That's good to know. I will say that I find that a little confusing. You're saying you can still spread it if you've been vaccinated. So why would the CDC say you shouldn't quarantine? Because part of it's to keep it from spreading, I think, right? The quarantining is to keep it from spreading. So I think, why would they say it's okay, you don't have to quarantine if you've been vaccinated?
Yeah, so a couple of reasons. One, obviously, the hope and goal is that, more and more folks are going to get vaccinated. So even if you are exposed and you've been exposed to the virus, you're not going to spread it because the next person would have been vaccinated as well. Also, if we are going to get back to, quote unquote, normal, in terms of resuming a lot of the activities we did pre-COVID, getting kids back to school as well, then we're going to have to be able to do those activities. And if we continue with the quarantine, it's going to take that much longer before we get to that point again.
That's very helpful. Thank you.
Sure, you are.
Well, this has been fantastic. You answered all the questions we got in our survey. I feel like staff got to ask you a ton of things. And so I just, on behalf of everybody at Community Housing Network, thank you so much for taking the time and attending our Lunch and Learn and giving us a lot of great information. Thank you.
Sam, I appreciate it. I just want to tell your organization, it has been a pleasure on my part to be able to sit down and answer just a few of your questions. I've learned a lot just from speaking with you, and I hope I was able to share some information that you may not have been familiar with. But again, it's my pleasure, and please welcome me back. I will be more than willing to do these kind of lunch and learns with you anytime. So Sam, thank you, and thank you to your organization.
Yep. Great. Thanks so much. And thanks to everybody else. And thanks for asking questions, everyone. Enjoy the rest of your day.
All right.
All right.
Good evening.
Take care.
Bye-bye.